Hey everyone! Has anybody ever told you about something called dental sealants? Maybe you're already familiar because maybe you have had sealants on your own teeth in the past, but if you're not, today's Tooth Talk Thursday video is meant to share lots and lots of information about this very simple yet highly effective way that we can help our children prevent cavities. So I'll go over what sealants are, how they're done, and why they are so helpful and effective in the prevention of cavity formation. For those of you who don't know me, my name is Dr. Bana Ball. I am a board-certified pediatric dentist and the founder of Shady Grove Pediatric Dentistry in Rockville. And so before we get into the nitty-gritty of sealants, I just want to point out something that I think is always a surprising fact for many parents, which is that tooth decay or cavities is still the #1 chronic childhood illness in the US, and 50% of the children in our country have cavities or have had cavities by the time they start kindergarten. So that's a really startling number. That's many, many young children. And so our #1 strategy in managing this is still prevention. Prevention is key in trying to make it so that young children don't have to experience the tough times that they can really have if they have cavities which require treatment, because as you can imagine with young kids, pre-K age, the tolerance and the cooperation can be really, really challenging. And so again, prevention is key. So on that note, let's talk about sealants. And we're going to do this in a question and answer format type of way. So I have 6 questions that I feel like by the time we get through them, you will be an expert on sealants. So question #1, okay, what exactly is a sealant? Very simply put, it's basically a barrier. And this barrier is applied to any parts of the teeth that have these little anatomic, what we call pits and fissures. I refer to them as nooks and crannies because I feel like that's kind of easy to imagine. But if you think about your own teeth even, or look at your children's teeth, I mean, you will see some areas on the chewing surface for sure where you see these lines that look like wrinkles, or sometimes on the sides of the molars there are these little indentations that kind of look like a dimple. So all of those areas tend to be hard to keep clean. Those are high-risk areas for cavity formation, and they're very susceptible. And by placing a barrier over them, we're essentially changing that anatomy in a very simple and completely non-invasive way, and thereby reducing the risk of plaque, bacteria, and food debris getting lodged in there and starting the decay process. So, and by the way, just as there is so much variety in hair, for example, where some people have completely stick straight hair, and some people have super curly hair, and then there's everything in between, it's not too different than saying that there are lots of variations like that in teeth as well. So for some people's molars, those little pits and grooves are very shallow, there aren't very many, and they're not as high risk. And then for other people, those indentations are very deep and very pronounced, and so that automatically changes someone's risk profile dramatically. So not all teeth are equal. The same that as it goes with hair and skin and everything else. So there are developmental and anatomical differences that have to be taken into consideration. So which teeth can be sealed? Really any tooth that is high risk based on the description that I just gave, right? So it doesn't really matter if it's a back tooth or a molar or a front tooth, because in some people there is a very deep and pronounced pit on the back surface of the upper front teeth. So, if that's the case, that would benefit from a sealant. Baby teeth can also have a lot of pits and grooves that would be susceptible, so those can benefit from sealants. So really it all depends on, is a particular site on a particular tooth high risk? If it is, it can benefit from a sealant. And one criterion I sometimes use is if I see staining, that's an indicator to me that this area is hard to keep clean. Any area that's hard to keep clean is potentially more at risk. So it's a lot of it is based on risk assessment, or cavity risk assessment, which is something that we do for every child at every visit, because risk also changes over time. as it then relates to diet and oral hygiene and everything else, because it's such a multifactorial thing, ultimately, someone's risk for cavities. So my next question was going to be, can you seal baby teeth? I think I actually just answered that, but yes, you can. And of course, that means we're doing this in younger children. And so it would look different than it would be in a much older child or in a preteen or teenager, or even if you've had sealants done as an adult. So the process is not always the same, the materials are not the same, and the techniques are not the same. But you certainly can do sealants. On my older child, who is almost 7, right before he turned 4, and this was right before Halloween, the deal was that we could only go trick-or-treating if we did sealants on his molars. So it was an easy choice for him. He came in and he was almost 4 at that point, and we put sealants on his baby molars. And I've even had a few children younger than that who have done exceptionally well. But a lot of kids around age 4 or 5 are tolerant enough that we can do some very basic sort of preliminary sealants on any high-risk teeth that they may have. So I think that's helpful to know. I think sometimes the assumption is it has to be permanent teeth, but that's not the case, especially if you can manage behavior and challenges. So, can sealants prevent all cavities? I wish. Unfortunately, they can't. I mean, they significantly reduce the risk of cavities by up to about 75%, so that's a tremendous amount. But as with everything else, it's not perfect. A lot of it still depends on diet and hygiene, so good brushing, making reasonable choices when it comes to what we're eating and how often we're eating, which is a really important factor. And of course, even someone's bacterial makeup in their mouth. I mean, as with all chronic or recurring infections, everyone's susceptibility varies, right? So that goes with acne and ear infections and just you name it. I mean, why do some kids or adults constantly have certain problems and others don't? It's not all about just what you are doing right or wrong, right? There are other factors, some of which we can't even really identify, but that's the nice thing. I mean, sealants work almost equally well in anybody. And someone who is extremely high risk, they're still going to have to do more on their own to really kind of fully harness the benefits of the sealants. And then the other thing is there are different types of cavities that would form in between the teeth. So on the smooth surfaces where the teeth kind of come together, and because those areas are not accessible to actually place material, those are not areas that can be sealed, and those types of cavities therefore cannot be prevented via sealants. So that's the limitation. It can only be done for the pits and fissures. How are sealants done? Well, it depends. It kind of varies. Again, I mentioned age is a factor. Age and therefore cooperation and tolerance, right? All those things kind of tend to go hand in hand. And sometimes even in older children, I mean, if there is a really pronounced gag reflex or lots of saliva, hypersensitivities to tastes or textures, I mean, all those things have to be taken into consideration when deciding how to do it, which techniques to employ, and which materials to use. So that gets a little overly technical, but there are lots of options. So ultimately, we find the one that's right for your child, and that's the way we would do it. But overall, the thing that they all have in common is it's not a painful thing to do whatsoever. The teeth do not need to be numbed, so there's no injections, no shots. We sometimes offer laughing gas just as a helpful adjunct because it can help with suppressing the gag reflex. And just if there are tolerance issues that can be minimized, we can offer that as something to do, but it's certainly not necessary by any means. It can be done, in a quick sort of in and out way, even on young kids, even if that means with a little bit of parental holding. Where there's a will, there's a way. And then the last question we'll review, and this is of course a really common one that parents ask, is how long do sealants last? And the answer definitely is it all depends, because every mouth is different, and the amount of wear and tear that the kids put on these sealants also is different. and their diet is different, and their oral hygiene is different, and whether they grind their teeth, and whether they even have, I don't know, sometimes it seems like kids chew rocks, but actually if they chew ice, which I always discourage all the patients from, because that can break a sealant very easily. So ice chewing is a big no-no, but for the most part, sealants tend to hold up very nicely, and we're talking about on the order of, years as opposed to, weeks or months. So now whether it's 1 year, 2 years, 5 years, that's where all the individual factors come into play. But they're incredibly effective, very helpful, and again, they're so easy to place that it's kind of almost a no-brainer that pretty much every child would benefit from sealants. So again, the way in which it's done is customized for your child depending on the specifics of the situation, and I think that's all on sealants. And now you know all kinds of stuff about sealants, but if you have any additional questions, any follow-up, or you just want more information, feel free to reach out. Our info is in the text below. And thank you so much for watching the video, and take care.